My name is Dr. Baptiste. I work as a GP, among other roles. In this video, we will look at the rare symptoms of migraine that you must know about. Most people are aware of the common symptoms of migraine. There are various types of migraines, and it might surprise you to learn about the symptoms that you could experience as a migraine sufferer. Quick note that this video is not a substitute for sound medical advice. If you have any concerns or experience any symptoms at all, please do visit your general practitioner for more advice. Before we get into this video, it's worth defining what a migraine is. A migraine is a very common type of headache, and 1 person out of 7 in the world will experience a migraine. Women are 2 to 3 times more likely than men, in fact, to experience migraines. A migraine falls into one of the 2 main types of headaches. There are 2 main types of headaches, primary and secondary. With primary headaches, there is no underlying condition found as to why the person is suffering with the headache. This is the category that migraine falls into. With a secondary headache, there is another condition that is causing the headache. Examples of this could be if you are suffering from an infection like meningitis or suffered a brain injury. So what are the common symptoms? A migraine is usually characterized by a quite intense head pain on one side of your head, but it can occur on both sides, and it's often described as a pulsating or throbbing headache. Common symptoms that you might also experience with this type of headache could be being sensitive to lights and sounds. This is what is commonly seen. However, this type of headache can occur with or without what we call an aura. Now we will look at the various types of auras. What is an aura? An aura is usually a temporary or fully reversible set of neurological symptoms affecting a specific area of the body. The neurological nervous system includes the brain, spinal cord, and the nerves that branch out into our arms, torso, and our legs. Examples of auras are seeing zigzag lines in your vision, for example, looking into a kaleidoscope. Other examples are perhaps pins and needles in your arms or legs. An aura may happen before the headache, or it may be associated with the headache. It is worth noting that visual auras are the most common. Key features of the aura are: it's fully reversible, it spreads gradually, and it should resolve within 60 minutes. In some cases, there is no headache at all with the aura, and the aura can be prolonged, lasting more than 60 minutes, but less than 7 days, or persistent, lasting more than 7 days. What is an atypical aura? So to answer this question, we're going to briefly look at 3 categories of migraines: hemiplegic migraine, migraine with brainstem aura, Basilar type migraine, or vestibular migraine. Retinal migraine. If someone presents with these symptoms in primary care, then depending on the situation, a specialist should be consulted, or they should be referred to A&E. Within hemiplegic migraine, there are 3 main types that have been shown to have a genetic component. In these cases, there may be other relatives, such as the patient's mother or sister, who suffer with symptoms. The person might experience weakness in their arm or leg, with weakness more often described in the arms. This type of aura tends to occur before the migraine by about 30 to 60 minutes, but it can last for hours to days after the so-called headache phase. As you can imagine, this might be confused with a stroke, and that's why it is so important to seek urgent medical attention if these symptoms occur. The final type, sporadic hemiplegic migraine, does not seem to have a genetic component. The second type is focused on the brainstem. Now, the brainstem connects your brain to your spinal cord. The brainstem hosts 10 out of 12 of our cranial nerves, and as the name suggests, the nerves that originate from your brain. These nerves help with your breathing, swallowing, hearing, and balance, as examples. So with this type of migraine, you could experience vertigo, double vision, difficulty speaking, tinnitus, so additional sounds such as ringing you could hear in your ears. What sets this apart from the first atypical aura is that there are no symptoms of weakness in the arms or legs, for example. Finally, retinal or ocular migraine occurs when there are several attacks of changes to vision or even temporary blindness in one eye. This is different to the visual aura that we have seen above, because that would affect both eyes or both visual fields. So those are the much rarer symptoms that can occur in migraine sufferers. If you do experience any of the above symptoms, please do get in touch with a health professional as quickly as possible. In the UK, you can seek urgent medical attention by calling 999. You can also go to A&E and call 111, who will put you in contact with professionals who can advise you. If you found the video useful, then please do give it a thumbs up, share it with someone who might find it useful too. In the next video, I'll be discussing evidence-based migraine treatments.